The Psychedelic Report.
Psychedelic drugs
have played their part in America's long, strange trip toward an understanding of mind-altering drugs.
The Psychedelic News.
Leading physicians, scientists, and experts share their wisdom about psychedelic medicines and healing.
50 years ago, psychedelic drugs were at the center of America's counterculture.
The brightest minds in psychedelic medicine. The Psychedelic Report.
We use the ketamine-assisted psychotherapy model that happens to have psychedelic effects that were not predicted when the drug was first developed.
From researchers to investors.
I think the biggest mistake we've made as a culture is the war on drugs.
To physicians to shamans and nonprofit pioneers.
Psychedelic drugs.
Recent research suggests some of them could have legitimate uses.
The Psychedelic News
brings you diverse perspectives from the front lines of this exciting movement. The Psychedelic Report.
The Psychedelic Report was brought to you by Apollo Neuroscience and produced by Future Medicine Media. Welcome to the Psychedelic Report, your single source of truth for the psychedelic news. I'm your host, Dr. Dave Rabin. I'm a neuroscientist and psychiatrist trained in ketamine-assisted psychotherapy as well as MDMA-assisted therapy. Today, we discuss the uses of the medicine ketamine and its safety profile in the context of Matthew Perry's tragic death. From the news media describing the situation, there is a lot of misinformation about ketamine that has surfaced in the public eye. A number of articles have come out over the last several weeks discussing the risks of ketamine and how ketamine was responsible for Matthew Perry's death, including one article by Andrea Kane on CNN Health entitled, "Has Ketamine's Time of Reckoning Arrived? 5 Things to Know After Matthew Perry's Death." Matthew Perry was a strong advocate for folks struggling with addiction, and it is very clear to anyone who works with ketamine as a clinician in the clinical environment that Matthew Perry's care was clearly mismanaged by those clinicians who were providing him said care. This creates a real issue in the field of mental health where ketamine is entering mental health and treatment as one of the leading anti-suicidal antidepressants that, when administered properly, is extraordinarily safe and a powerful tool for helping those with depression recover. Interestingly, it is also one of the only antidepressants that has almost immediate anti-suicidal effects. Those who work with ketamine are also aware that in the proper doses, ketamine is an extremely safe medication when administered correctly. However, the media and the way that the media in general has approached this topic, not to mention the Los Angeles County Medical Examiner's Office, who determined that the cause of death were the acute effects of ketamine rather than drowning, really cast a shadow on the use of this powerful medicine in mental health patients. To break down this topic and to really understand what happened to Matthew Perry, we have a very special guest today who's really one of the nation's leading experts and physicians treating patients with ketamine. That guest is Dr. Jonathan Edwards. Dr. Edwards is an anesthesiologist and medical practitioner specializing in human health and optimization. He is perhaps best known for treating mental health conditions with ketamine, a dissociative anesthetic that is used for general anesthesia, pain management, and depression. Dr. Edwards also uses ketamine to help adolescents overcome depression and suicidal ideation. In today's interview, we talk about his new book, The Revolutionary Ketamine, the safe drug that effectively treats depression and prevents suicide. More Americans have died from suicide than all wars since Vietnam. The suicide rate among 10 to 24-year-olds in this country increased 62% from 2007 through 2021. As Dr. Edwards points out in today's discussion, most people are not aware that American children between the ages of 10 and 14 are twice as likely to die from suicide than homicide. Dr. Edwards explains that suicide is a pressing problem in America. He also points out that police and firefighters are more likely to die from suicide than in the line of duty. This is an astonishing figure. Dr. Edwards then gives an overview of ketamine and its ability to help treat depression and suicidal thoughts. Dr. Edwards pivots to mention the dark side of ketamine, including ketamine misuse and overdose. Recent studies have reported a worldwide increase in ketamine misuse and overdoses. Back in October, Matthew Perry, one of the stars of the popular sitcom Friends, died from what the Los Angeles coroner described as the acute effects of ketamine. Because this was such a high-profile case, Dr. Edwards gave his opinion on what happened to Matthew Perry and discussed the potential adverse effects of ketamine. Dr. Edwards is a board-certified anesthesiologist who treats chronic pain patients. He is the author of several books and medical papers, including The Revolutionary Ketamine, Stopping Pain, Passing.Dr, Suicide, COVID-19, Ketamine, and The Science of the Marathon. He practices medicine in Las Vegas, Nevada, and Port Orange, Florida. Dr. Jonathan Edwards, thank you so much for taking the time to join us today to discuss this rather sad and timely topic around the uses of ketamine as a medicine and the misuses in this particular case.
Oh, yeah, it's good to see you again, Dave. Thanks for having me.
I really wanted to bring you on the show to comment and help inform our community about what is really going on with this tragic death of Matthew Perry. And there's a lot of talk about the role of ketamine in his death. And, there were even very strong implications, like I think it was from the Los Angeles County Medical Examiner's Office, that said they determined that the cause of death was the acute effects of ketamine.
Yeah.
That creates a lot of wariness around ketamine because most people don't understand the drug. They don't know the origins. Right. They don't know how safe it is. And there's a lot more to it in terms of, how ketamine's been used and what it's helpful for. And in this case, it was clearly not being used. At least we've seen, it seems like from the subsequent news that's come out, it was not being used in ethical ways. And so could you comment a little bit about, and maybe start with updating us a little bit about where things are at currently in this situation / now investigation of the folks who are working with Matthew Perry and kind of what the impact this has had?
Sure. Yeah. Just a little background on myself. I'm also a medical doctor, a 25-year veteran anesthesiologist. I've been using ketamine my whole career. In addition, I use ketamine, as you know, to help treat mental disease, stop suicide, and I work with psychiatrists and psychologists like yourself in conjunction with ketamine therapy, to help people. So the whole Perry situation is giving ketamine a black eye. Seems like any media source that can jump on that bandwagon is just kind of going along with it, saying that ketamine is a dangerous drug. It should be more regulated, so these kind of things can't happen. And it comes with people who have access to anesthetics, especially, and when they're addicted to a substance, are going to use it wrong, and it gives the whole name just gives a bad name to why we use it. This happened with Michael Jackson and propofol, and I just wrote that article on my Substack. And the Perry situation is very reminiscent of the Jackson situation. They're both
Absolutely.
anesthetics. They were both used irresponsibly. They were both addicted, and they both had more than enough money to hire the right people to keep them safe.
Right.
But at the end of the day, the drug was used wrong in the wrong setting by people who were not qualified to give the drug and overlooked the environment it was given in and just completely ignored the potential of what happened. And, so to go back to the coroner report, he had over what we call, about 3,000 nanograms per milliliter concentration, which is consistent with general anesthesia.
Wow.
That was at the time of his death, So what's interesting about
that's comparable to the amount of ketamine that you would give somebody
push in an operating room.
Yeah, to knock them out before going into the operating room for surgery.
Correct.
Right.
Yep.
So getting into a hot tub or a body of water under that, any level of sedation is known to be dangerous, but under that level of sedation where you basically lose control of your body's ability to move is a really, really bad idea.
But here was my beef with the whole coroner situation. I get the levels were that high. But what I've said from the get-go that doesn't make sense is there were no marks on his body suggesting intravenous administration nor intramuscular administration. There was no ketamine paraphernalia found on the premises when the police arrived. He was known to have coronary stenosis of his left anterior descending artery of over 70%. He had just got done playing a couple hours of pickleball. And then the latest, the latest news is that he was using ketamine, every day, apparently. And the quote from the New York Post he said to his assistant, "Give me a big dose." It's like, so obviously he's been doing this for a long time, and we know he was a seasoned user of ketamine in the clinics for at least 5 years to my personal knowledge, but he was clearly addicted to it, using it every day. And that's just such the wrong message to put out, and a sad message. And what he did for addiction medicine and addicts with this foundation, was huge, and all that's gone now. So in a sense, that's what's really sad about it.
Just to add to the sadness of it, this is totally avoidable, right?
100%.
Like, this was completely avoidable because these doses of ketamine are inherently safe when given under proper supervision. Right, like in the OR, but the problem is that there was a lot of human error introduced along the way that resulted in this person being administered improper doses of medicine on a daily basis that should not be administered daily, a medicine that builds extreme tolerance. And he was obviously in a lot of pain, right? Like, it doesn't take a rocket scientist to look at what Matthew Perry was going through and to understand his journey a little bit, and to say, hey, this guy was probably in a lot of pain, which is why he was numbing himself with ketamine. But it's our job as clinicians to teach him how to do that without becoming dependent on the addictive substance that can ultimately kill you, right? If you accidentally misuse it, right?
Yeah, that highlights you have to have therapy with this. You have to. It's just it goes hand in hand. I don't believe in the use of ketamine without therapy.
You're listening to The Psychedelic Report.
Perry was once quoted saying that he didn't like the side effects of ketamine, and it felt like he was hit with a shovel every time he used ketamine, but he preferred that hangover effect of, so to speak, being hit by the shovel rather than having to use the shovel to dig his grave.
Wow.
So that was in his book, and I'm paraphrasing it. But so I want to get back, though, to his levels of ketamine. And I think he was very used to those levels, just like Jackson was used to his levels of propofol. Obviously, they both got away with it for months to years, using it at their homes.
Right.
But the thing that still gets me is ketamine, even at that dose, doesn't decrease your respirations. In fact, there's good studies to show it increases the respirations. And let's just say, he was so
unlike propofol and opiates,
propofol, you're done.
And which will knock out your respiration
and heart rate and everything.
Right.
And so his blood pressure was pretty much supported. And my point is even at that level of ketamine, let's just say he fell in the tub and started drowning. What bothers me about this is that hypoxic response to drowning should have overcome any effect of ketamine, at least for a minute, to stick his head above a foot of water. He wasn't in that deep of water. I could understand a deep pool, but, neither one of us are there. And this is, of course, all speculation. It just bothers me that he was in a jacuzzi and all he had to do was put his head above water, maybe swallow some. But something else happened at that moment where he could not do that. Was that all ketamine euphoria, or was it an attempted suicide, or, successful? Or did he have a heart attack at the same time? Or
did he have a vasovagal episode, right? Like a lot of people
People don't realize that sedatives amplify this effect, but there are a lot of people, I've had it happen to me, where you're in a hot tub and you're submerged even below the waist, and then you get in above, and all the blood rushes to your legs almost instantly because your body heats up so much. Right. And then all that blood leaves your brain, it leaves your heart gets less blood because it's all down there. And that could also induce a fainting episode that, combined with the ketamine, could have done it. Right.
Right.
So it's regardless, I think the important note is that there is a preponderance of evidence that would strongly counter what the Los Angeles County Medical Examiner's Office has been saying and putting out, and much of the news has been putting out, that as clinicians who work with ketamine frequently, the cause of death is not ketamine. It was, in fact, drowning.
Yeah, that 100%. Just like, it wasn't like, it's not like propofol killed Michael Jackson. It was, the fact that, Conrad Murray used a run-of-the-mill pulse oximeter and, wasn't even Bluetooth enabled, and got to him as his airway obstructed and he was hypoxemic for many minutes.
Wow.
That's what killed him.
Right.
And, and same thing with Perry, somebody who really would have known what they're doing, could have recognized the signs and symptoms of what he was going through, perhaps pulled him out of, resuscitated him. You can lose your airway on ketamine. I've seen it happen.
Yeah.
Yeah. So anyway, a lot of speculation there, but I think, like you said, it's so important to highlight ketamine is a safe drug used in the proper environment by the proper professionals and people who care about giving it to you. If anything,
and a proper dose.
Yeah. I hope that's what people get from discussions like ours and articles like I've written. That's the point. It's like, it saves lives. We don't have any other drugs, as you know, as a psychiatrist, that do that. There is no other drug that can take you from an acute suicidal ideation state, change your hope equation, and then put you somewhere else that you don't want to take your own life, at least for that point in time, and maybe get you that life-saving help, that's going to help you down the road.
Yeah. Absolutely. And that's a great segue, because that, to me, is one of the most underappreciated and under talked about things about ketamine. And it's really quite incredible, as, at least from my understanding, the only anti-suicidal antidepressant that we have that is acutely anti-suicidal. And you wrote a book on this, that is a wonderful book.
Revolutionary Ketamine.
Yeah. I love the spinning entry.
Yeah.
So I think I would love to talk about that. Could you, for most people have no idea, most people don't realize, number one, that antidepressants, the standard run-of-the-mill antidepressants we all take, for the most part, are not considered acutely anti-suicidal agents. So what that means is that you come into your doctor, you come into the hospital, and you say, I'm feeling depressed and I'm having these thoughts about wanting to hurt myself. And the doctor will often start you on a typical SSRI or tricyclic or other form newer antidepressant. And that's usually the first line. And even before talk therapy, which should be the first line. And those do not have any significant benefit towards decreasing suicidal thoughts, expected for about 12 weeks. At 12 weeks. And sometimes people don't have benefit for much, much longer. Ketamine, with a single injection in somebody who comes into the emergency room or a clinic acutely suicidal, can have a benefit of relieving their suicidal thoughts and their urge to commit suicide for 2 weeks more. And in some cases without any therapy, but seemingly much better with therapy. Could you talk a little bit about how this was discovered, if you remember the story? And
the history of it.
Let's do it.
The revolutionary ketamine, and it's a derivative of angel dust, as you know, PCP or phencyclidine, which was used in operating rooms in the late 50s and 60s. However, the postoperative delirium was so bad with that drug that the anesthesiologist said, we can't deal with this. We need another form of this. It works great as an anesthetic, but the nightmares and bad side effects were just too much. So they came
PCP delirium is real scary, very scary.
So ketamine was discovered because of the need to find a new anesthetic from phencyclidine. And basically it coincided with the Vietnam War. So they developed ketamine. Ketamine was kind of looked at as a research drug, but then once they found out, it was a great anesthetic because you didn't need to support somebody's respiratory. You don't need to support somebody's blood pressure so much, and it can be given without oxygen. It makes it the ideal drug or anesthetic to be used in rural areas. And then it happened to be so in the Vietnam War, as you know. So it was considered a buddy drug, so if your fellow soldier was injured, they could be given ketamine reliably, dissociate them from the trauma, and get them to safety without worrying about their breathing and, depending on the wound, of course, but, their blood pressure wouldn't suffer too much, say, as if they went to morphine.
Right, or if they went into shock.
Correct. Then it was realized in the 70s, it really gained traction in pediatric anesthesia because, in anesthesia, especially in pediatrics, a breathing patient is an alive patient. You wouldn't believe how important that becomes in the operating room. We don't paralyze everybody. So ketamine was known because it did not affect the respirations as bad as other anesthetics. And so it became very popular up until the advent of propofol, which most people know. And then once propofol came around, it's a more pleasant experience. It comes on and off faster, doesn't have the risk of postoperative delirium with high doses of ketamine. But, ketamine's still given every day in the operating room. And finally, in the 90s, the British team found that ketamine was helpful for disorders like bulimia and anorexia. And then that got to the Yale guys. So we're talking John Crystal, Dr. Bergman, all those guys. And then they showed that it helped depression. And then they showed it helped suicide. And then the NIH was so flustered. Thomas Insel told me the story. They were so flustered that they did a will to live, a will to die study. And they couldn't believe the results, that how ketamine increased the will to live side of the study so much that the fact that ketamine stopped suicide became undeniable at that point. And that's when you started seeing this increase in mental health practitioners using ketamine kind of the way it is now. And I mean, you have to realize it's still not FDA approved, so to speak, for mental health purposes, but the effects are so obvious, and it's the only drug, that we have. And Thomas Insel, again, his quote was that ketamine is the most significant discovery in 50 years for combating suicide.
You're listening to The Psychedelic Report.
That's incredible. And for those who don't know Tom Insel is the former head of the National Institutes of Health, right?
Correct. Yep.
So it's a big statement coming from the former head of the National Institutes of Health that ketamine is the biggest discovery in the area of suicide in the last 50 years. They fund most of that research. So, I think the two things I want to ask you is about that will to live, will to die study. Number one, Can you send that to me?
Sure. I reference it in the book for sure. Yeah.
I would love to check that out. I've never actually read it firsthand. And number two, what year was that?
Oh, to early 2000s, 2006 or 7, if I'm not mistaken, maybe late 2000, something like that. It was after the Crystal and Bergman studies at Yale.
Right. I just want to reiterate the synopsis of what you described, which is that as of the early 2000s, we're talking like almost 20 years ago, if not 20 years ago, it was undeniable that ketamine had distinct and significant therapeutic effects in the way of reducing suicidal ideation and symptoms of depression.
Well, as a fun aside, it was even known in the 70s. So there's an article by Dr. Domino. He was a pharmacist who specialized in mental health, and he even helped run a clinic. And there's an article called "Taming the Ketamine Tiger," and It's by Edward Domino in the 70s. And his exact quote, if I recall, was that he had a patient who was addicted to phencyclidine and ketamine at that time. And he asked the patient, he says, why are you addicted to this? What's the catch? And the patient says to him, oh, that's easy, doctor. I've been on antidepressants for years, but they don't work. Ketamine, it works. Because he asked, like, why did you stop your antidepressants? And it's because of the ketamine worked so much better for her. And that article was 1972, I think. So we've known about the mental health benefits of things like ketamine for a long time. But let's remember, all that research was squashed in a sense or suppressed with the advent of, Nixon and his war on psychedelics. And I think that was one of the big things why it took so long for ketamine to kind of come out of its shell and be what it is today.
That's really interesting. And I think just to draw everybody's attention to how long it takes to get great discoveries from the bench to the bedside, right? Yeah. Even like this is an incredible discovery. The former head of the NIMH has admitted this is an incredible discovery. And yet, as a society, as a medical community, we have still struggled to provide ketamine as a early line antidepressant treatment. And we've really struggled with guidelines around how to do that safely for patients so that it can be scaled more effectively throughout the psychiatry community, right? Because right now, I mean, I would venture to say probably like 90% of psychiatrists don't do ketamine work. But Thomas Insel has said, as you said, and the evidence is undeniable from these studies and proposals back from the 70s, but, going to Yale's work in the early 2000s, right, that we know that this is effective, extremely effective for depression and suicidality. And yet the psychiatry community is very, very behind on this, and patients are more in need than ever. Do you see any opportunities for how we can, as a community, as a field, do a better job of bringing this medicine to the community at scale safely?
Yeah, I think it's happening through people like Robert F. Kennedy right now at the top. People like that need to get behind psychedelics for the use of mental health disorders. And you need to see this shouted from the rooftops from our politicians. Every president, including the current, have had task forces for suicide. Yet the rate of suicide has only gone up to almost more than 50,000 people per year. And as you know, it dips down into the 30,000s. I mean, but come on, tens of thousands of people, and we can't help them. So whatever we're doing, I don't think is, it's a hard question. It goes exactly into what you're asking. So where does it need to come from? I think it needs to come from the acceptance of government officials, politicians, business people, small business owners. It needs to come from the acceptance of parents. If a parent thought and could recognize the signs of their child wanting to take their own life, what parent wouldn't use ketamine to at least give it a shot? And I have received hundreds of emails exactly in that manner. So those are some of the arguments I make in the Revolutionary Ketamine. But I think that's where it's ultimately going to come from. And make no mistake, very influential people a lot of them have tried ketamine. Elon Musk.
Ketamine use is extremely common right now.
Extremely common. Yeah. So I think we're at a better place than we were 10 years ago with it. And I just hope the trend keeps going, and things like you and I are doing help get past these black eyes of the Matthew Perry story, for example. We can take 2 steps back and then hopefully 4 to 5 steps forward. It's going to take those kind of efforts, to further the cause, I think. And at the end of the day, save lives. That's what it does. Not everybody, it's not the panacea, but for a lot of people, it is the difference. you know?
Yeah, absolutely. And it's really encouraging to hear that from another practitioner who's actively doing this work and who's been doing this work with ketamine for longer than most people that I know. And so I really just appreciate you and all your hard works sharing the knowledge and the wisdom that we've learned from the medical community about how powerful this medicine is, how safe the medicine is when used properly, and what the real potential of it is to transform the mental health space and the way we look at psychiatric disorders, because that's really what it's doing. And if Tom Insel can get it, I think anybody can, right?
Right.
So I mean, those are big words that most people have not heard from him, right? People don't realize that the head of the NIH has recognized ketamine as being this important, right? So I think that's great. It's great to be reminded of that as we wrap this conversation. And would you mind sharing, just to wrap up, would you mind just sharing with people where they can find you, your book, and if you want people to follow up with you?
Yeah. Just actually, you can at jonathanedwardsmd.com. Jonathan spelled with an H. So at John Edwards MD on most social media, X, Instagram, and things like that. I actually just put out for National Suicide Awareness Day yesterday. I put out a couple videos and some articles on my Substack that apparently have gone very well. And yeah, and I'm reachable, so I'm happy to help where I can, and that's where you can find me.
Dr. Jonathan Edwards, thank you so much for joining us today.
It's a pleasure. Thanks for having me.
Thanks for listening to The Psychedelic Report. Visit us at thepsychedelicreport.com. This show is recorded weekly on Clubhouse with a live audience. The Psychedelic Report was brought to you by Apollo Neuroscience and produced by Future Medicine Media. While I am a doctor, I'm not your doctor. So please don't take anything you hear on the Psychedelic Report as personal medical advice, because we don't know you. If you have questions about anything you hear on this show, please consult with your doctor.